Now that you know how to work the player, click on the Start button and let's get started.
Diet and nutrition during and after treatment. Welcome to this video on how you can benefit from the healthy dietary patterns described in the American Cancer Society Nutrition and Physical Activity Guideline for Cancer Survivors. Diet and nutrition during and after treatment. Good nutrition can help you to manage your energy level, stay strong during treatment, and feel better afterward. Your specific nutritional needs will vary depending on your type of cancer, your treatment program, and your existing health conditions. Eating well during treatment. There are several general strategies that you can follow for eating well during and after treatment. Let's have a look at 6 of them. Consider trying out some new foods and tastes. You might find some new foods that can help you to eat well and maintain your body weight during treatment. Try to eat a variety of plant-based foods such as beans and peas for protein instead of meat. Try to eat more colorful vegetables and fruits every day because they contain many natural health-promoting substances. Try to stay physically active and maintain a healthy body weight. Don't worry about small weight changes. They are normal during treatment. Limit or avoid consumption of red or processed meats. Limit or avoid salt-cured, smoked, and pickled foods. Nutritional assessment, counseling, and ACS guideline. The American Cancer Society recommends that you get a nutritional assessment and counseling as soon as possible after diagnosis. This is because cancer treatment may cause eating challenges such as poor appetite, chewing and swallowing problems, digestive problems, and feeling tired. The counseling can help you to identify and prevent nutritional deficiencies, manage your side effects, and preserve your muscle mass. If you are worried about not getting enough nutrition, a registered dietitian can help you with counseling and a personalized nutrition plan. You may be able to find free or low-cost nutritional counseling or educational programs through your healthcare provider, local health department, community center, or the YMCA. If you have no problems with getting enough nutrition, you should follow the healthy dietary pattern described in the ACS guideline for diet and physical activity for cancer prevention, which defines a healthy diet as one that includes whole grains, fruits, especially whole fruits in a variety of colors, a variety of vegetables, dark green, red, and orange, fiber-rich legumes, beans and peas, and others. Foods that are high in nutrients in amounts that help you get to and stay a healthy body weight. A healthy eating pattern limits, or does not include, red and processed meats, sugar-sweetened beverages, highly processed foods, and refined grain products. Healthy eating patterns. A healthy eating pattern is a daily eating pattern that includes foods that are high in nutrients, such as colorful vegetables, fruits, beans, peas, and whole grains. A healthy pattern also limits the consumption of red and processed meats, sugar-sweetened beverages, and highly processed foods. The 4 diets shown in the list are all examples of healthy eating patterns that can support the nutritional goals of cancer survivors. All 4 diet patterns are consistent with the ACS guideline for diet and physical activity for cancer prevention. The Mediterranean diet is a generic term for diets based on the traditional eating habits in the 16 countries bordering the Mediterranean Sea. Typically, Mediterranean diets include plenty of fruits, vegetables, fish, beans, nuts, and seeds. Olive oil is used as a primary source of dietary fat. The dietary approaches to Stop Hypertension diet is a flexible and balanced eating plan that focuses on creating a heart-healthy eating style for life. The United States Department of Agriculture Healthy Eating Index measures adherence to the federal dietary guidelines for Americans. The Harvard Alternative Healthy Eating Index, AHEI, assigns ratings to foods and nutrients to indicate their association with chronic diseases. Research shows that a healthy eating pattern, like these ones, is associated with higher likelihood of overall survival for breast cancer survivors. In addition, the Mediterranean diet is associated with lower risk of death in prostate cancer survivors. However, a Western-style dietary pattern, which tends to be high in red and processed meat, high-fat dairy, refined grains, sweets, and desserts, has been linked to worse outcomes for breast, colorectal, and prostate cancer survivors. Alcohol. Currently, there is not enough good evidence to make a specific recommendation on alcohol consumption for all cancer survivors. However, studies show that alcohol consumption increases mortality among people with certain types of cancer, including head and neck, laryngeal, pharyngeal, and liver cancers. The link between alcohol and mortality in other cancer types is not as clear. It might be best to avoid or limit alcohol consumption during your cancer treatment, especially if your treatment involves chemotherapy or puts you at risk for mouth sores. This is because alcohol can interact with chemotherapy drugs, can aggravate sore spots during radiation, and can cause liver inflammation that can affect chemotherapy drugs and worsen toxicities. Alcohol intake can increase the risk of several types of cancer, so avoiding alcohol is recommended for cancer prevention for everyone, including cancer survivors. If you choose to drink alcohol, limit your consumption to no more than 1 drink per day if you are female or no more than 2 drinks per day if you are male. The standard drink size is 12 ounces of regular beer, 5 ounces of wine, or 1.5 ounces of 80-proof distilled spirits. Resources. This section describes several useful survivorship resources. The first resource shown on the left of the screen is an American Cancer Society infographic that summarizes the diet and activity guidelines for reducing your risk of cancer. The second resource is the Academy of Nutrition and Dietetics website, which has resource pages dedicated to nutrition for cancer patients before and after treatment, and where you can search for a registered dietitian nutritionist in your area. The third resource is the American Institute for Cancer Research website, which provides several helpful sections on planning and preparing before, during, and after treatment. The fourth resource shown on the right is an American Institute for Cancer Research resource on how to read nutrition labels. Thank you for watching this video on diet and nutrition during and after treatment. We hope that it gave you useful information and resources for your cancer journey. For more information on the benefits of healthy behaviors for cancer survivors, please see the other videos in the collection.